Hello everyone, thank you very much Malaysian Anatomical Association for inviting me for the Faces of Anatomy slot. My current designation is the Professor of Anatomy, Faculty of Medicine, Universiti Kebangsaan Malaysia. Since I joined UKM in 1995, this is my 26th year in Anatomy Department, Faculty of Medicine, UKM. I like all aspects of anatomy, but I think the one that I like most is the gross anatomy, because this is where you can visualize the structure directly, hold it real time, and visualize the relationship between the structures inside the human body. Another aspect of gross anatomy which fascinates me is actually clinical anatomy. This is very important. Clinically applied knowledge of anatomy, and this is particularly for the clinical subjects, especially for postgraduate clinical studies in ENT, surgery, and also orthopedic. I think the factor that inspired me or motivated me to become anatomist way back in 1985 when I was a student in University of St. Andrews. There we had a chance to do that section, like one cadaver per 6 students, and that's where has generated my interest in anatomy, that I get to hold the structure, to see the relations, to do the dissection, and to appreciate the structure more. And that, I think, is the impetus for me to become anatomist. Since the inception of MAA in 2013, I was the pro-tem secretary then, and then we had the annual general meeting, and I was elected as the secretary from 2013 to 2015, and after that I was elected as the president for 2 terms from 2017 to 2019 and 2019 to 2021, and currently I'm the advisory panel of the Malaysian Anatomical Association. I like the energy, the positivity, the proactiveness of the members, especially the committee members of the MAA. This is where new ideas, brainstorming, and also opinions are voiced out, so that after that we decide on what to do for the betterment of the association. That is the best that I like about the Malaysian Anatomical Association. I think the most memorable event is when we organized the Malaysian Anatomical Association Conference in 2009. This was the first conference that we organized as an association, because as you know, the association is very new. It's only starting in 2013. In this conference, we managed to gather anatomists from 10 countries, and I think it was really a big achievement for us. And I feel that everybody worked hard, especially the committee members have worked hard to make MAA to be known to the international setting, and it was a success. Anatomy comes from the Greek word means anatome, means to cut up, means we have to do the dissection. That is where anatomy is all about. So I think the greatest challenge is to get cadavers, to get for dissection, or even to do prosected specimen or plastinated specimens. Another challenge is the advent of technology, especially in the era of 4th Industrial Revolution, where we have using of software, using of computer aided, and also the using of artificial intelligence in teaching anatomy. As an anatomist, I do feel that all this can be an adjunct to the teaching of anatomy, but the student need to hold to see the real thing, to see the real specimen. And I think especially for the postgraduate levels, the cadavers, dissection, or even prosected specimen are very important for them. My advice to the fellow anatomists is to stress on the salient points of anatomy subject. not on minute details that we had to learn 20 to 30 years ago. And all the fellow anatomists, is good to keep abreast with the changes, with the challenging teaching, learning of anatomy that has undergone changes throughout the years. Last but not the least, I would like to advise all my fellow anatomists to teach with passion, with sincerity, use analogy, and make it easy for the students. And this will make the teaching of anatomy exciting, and the student will love the anatomy, which is the key fundamental subject in the preclinical years. With that, I wish you all the best in your future endeavor. Thank you.